they've cut no corners here on making sure to protect themselves as they do their work. At the bottom of your screen, just below our barrier, you see the Spanish flag there. This is Tenerife, just off the coast of Spain. That is where the ship has docked for evacuation and refueling. So this is just an ongoing situation here, and it is certainly scary for all involved and scary for the world at large, because this is now a post-COVID world where everyone has truly experienced a global pandemic rather than just reading about them or learning about them or fearing their potential. They have actually been experienced. And so now when stories like this pop up, it's near impossible not to have visions of 2020 and 2021. But again, officials have stressed that this is not COVID, that they have more knowledge and understanding of this particular virus, and that the risk to the general public is considered low at this time. All right, let's go to that press conference and take a listen out at the University of Nebraska Medical Center.
Well, good morning, everybody. For those of you that are new, welcome to Nebraska. I can't start but begin by expressing my incredible appreciation for the countless professionals, both federal, state, and local, who have burnt the midnight oil and worked extensively in the last days to have a safe transfer of the American passengers from the Canary Islands to their arrival in the great state of Nebraska here in Omaha. It's been a highly coordinated effort, many agencies, one that has gone incredibly smoothly. It's due to outstanding communication and coordination of everyone involved. And I simply want to acknowledge and be grateful for their incredible hard work. The passengers who are here at UNMC are going to receive nothing but world-class care. It's a guarantee. You can take it to the bank. This is not the first time Nebraska has been called upon to provide the facilities and care that's required. Critical medical situations like this arise. As governor of the extraordinary state of Nebraska, it makes me proud to know that these capabilities exist in our state and that we can provide the assistance when it's needed. And I know all of my fellow Nebraskans are as well. As I could speak directly to the passengers who are now calling Nebraska and UNMC home for the coming days, we're glad that you're here, and we're going to ensure that you have the best world-class care possible. We know it's been very difficult for you and an arduous journey, one that will keep you away from your friends and your loved ones a little while longer. But you can be assured the medical staff at UNMC are highly trained and compassionate, extraordinarily compassionate caregivers. And whatever they are, and we can do make your stay as comfortable as possible, we will do. We have walked hand in hand with our federal partners from the White House to Secretary Kennedy to the CDC and all of their great teams. I am satisfied, and Nebraskans can be, that the rest of America can be satisfied that there is a strong plan in place and to ensure the folks are secure for their initial assessment, and we're working diligently to ensure no one leaves this security in an unsecured way at an inappropriate time. No one who poses a risk to public health is walking out the front door of the streets of Omaha or beyond. Again, I simply want to say thank you again, Dr. Gold, to you and your team and all of our federal partners and state and local agencies that have all had a hand in facilitating and making an impact on getting Americans back home. Thank you.
Thank you, Governor, and it is now a pleasure to provide some more information specifically on the operations and the condition of the passengers. I'd like to introduce Admiral Brian Christine. Admiral Christine is the Assistant Secretary for Health of the United States Department of Health and Human Services. Admiral.
Well, good morning, and thank you all for being here. Thank you especially to our partners at the Administration for Strategic Preparedness and Response. Thank you to Nebraska Medicine, and thank you to the University of Nebraska Medical Center. Thank you all for your leadership and your readiness in this response. At the Department of Health and Human Services, our approach is grounded in science, it's grounded in coordination, and it's grounded in transparency. This is a whole-of-government effort across federal, state, and local partners who are all working together to ensure the safety of the American people. And let me be clear, let me be crystal clear, the risk of hantavirus to the general public remains very, very low. The Andes variant of this virus does not spread easily, and it requires prolonged close contact with someone who is already symptomatic. Even so, we have taken this situation very seriously from the very start. We've taken it seriously across HHS and particularly through the Centers for Disease Control and Prevention. And I'm proud to see many of my U.S. Public Health Service officers have been actively engaged in the response. The CDC rapidly activated its Emergency Operations Center. It deployed medical teams to assess passengers and coordinated closely with international partners. They have notified state health departments, they have initiated monitoring of potentially exposed individuals, and they have issued clinical guidance through the Health Alert Network. And they have also brought together national partners through coordination calls. They've developed tools and resources to support public health decision-making, and they have ensured that both clinicians and the public have clear, timely information. Transparency has been and is the order of the day. And now, with the safe arrival of these U.S. citizens here in Nebraska, CDC teams are working side by side with ASPR, with UNMC, and with state and local officials to conduct assessments and provide ongoing monitoring and care. This is what strong public health system looks like. Experienced professionals, seamless coordination, and a shared commitment to protecting the American people. We will continue to follow the science, we will stay vigilant, and we will keep the public informed every step of the way. As I said, transparency is the order of the day. Thank you. Thank you for being here. God bless you. God bless the state of Nebraska, and God bless our republic. Thank you.
Thank you so much for those words. And now it is my pleasure to introduce Mr. John Knox, who's the Principal Deputy Assistant Secretary, Administration for Strategic Preparedness and Response in the U.S. Department of Health and Human Services, and he will give us an update on planning and as we move forward.
Thank you, Dr. Gold, and thank you, everyone, for being here today. As mentioned, I'm John Knox. I'm the Principal Deputy Assistant Secretary for the Administration for Strategic Preparedness and Response. I'll start by noting that what you're all seeing here today is a true partnership and a demonstration between public and private partnerships. As all of you are aware, last night, with the coordination of multiple federal agencies and in partnership with state officials, HHS supported the Department of State in a safe repatriation of 18 U.S. citizens from the MV Hondius. This is a coordinated, whole-of-government effort to safely return Americans home while protecting public health. Passengers were transported via Department of State plane from the Canary Islands to Nebraska with appropriate medical capabilities on board. HHS has worked with the State Department from the start for a seamless transfer back into the United States. Upon arrival, they were transferred here to the University of Nebraska Medical Center. UNMC was selected as the U.S. entry point due to its extensive expertise in handling special pathogens, and it's the only national quarantine unit in the country. It is one of ASPR's 13 regional emerging special pathogen centers, also known as RESPECs, that are within the National Special Pathogens System. ASPR has established this system over the years to prepare for high-consequence infectious disease outbreaks with trained personnel ready to safely manage situations like this. ASPR's mission is to protect the health security of Americans, and this response reflects the strength of the national preparedness system. As mentioned by others here this morning, over the next several days, passengers will undergo an initial health assessment and receive guidance on next steps from the CDC experts and other partners. This event reflects our ability to coordinate across federal, state, and local partners when the health of any American is on the line. So at this point, I'm going to turn it back to Dr. Gold to continue. Thank you.
Well, thank you, Secretary Knox. We have several people here, as of course you can see. Just to introduce them quickly, we have Brendan Jackson. Dr. Jackson is from the Centers of Disease Control and Acting Director of the Division of High Consequence Pathogens and Pathology. We have Captain Michael Gardner, also from ASPR, as the Regional Administrator, Region 7 of the Mission Field Operations. We have Matthew Ferrara, who's a DVM and is a HHS counselor. We have Dr. Michael Wadman here from the University of Medical Center and Nebraska Medicine and is the Director of the National Quarantine Unit. We have Dr. Angela Hewlett, who's the Medical Director of the Nebraska Biocontainment Unit. We have Dr. Deli Davies, who's the Interim Chancellor of the University of Nebraska Medical Center, Dr. Michael Ash, who's the Chief Executive Officer of Nebraska Medicine, and by the way, thank you for hosting us. And we have Dr. Ashley Newmeyer, the Director of Public Health for the state of Nebraska. And before I take your questions, I just want to say that UNMC and Nebraska Medicine are very honored to have this responsibility to repatriate these American citizens. There is no place in the country that they could be better cared for, more safely and more effectively. As the governor said, it is the people of the state of Nebraska, and indeed here in this microcosm, it is the people of UNMC and of Nebraska Medicine that really make a difference to truly lead the world. And today, as you're all gathered here, there is no other place in the country where they could be more safely and more humanistically cared for. We have a very simple rule here, and having served as the Chancellor of the Med Center for more than a decade of my life, if we treat our patients the way we would treat family members and loved ones, we're going to be okay, and that's the rule. So with that, we're very willing to take your questions. There are microphones that we will pass around. If you do have a question, I will recognize you, and there are some folks who are carrying the microphones just to be sure that everybody can hear your question. And if there's a specific individual that you want to address it to, that's fine, or we can just have volunteers.
Thank you. Hi, Waverly Monroe with KETV. Just wanted to talk a little bit about AP confirmed overnight that there was a person who was experiencing symptoms but may have not been tested positive for hantavirus. Can you talk a little bit more about that? And is that person at the National Quarantine Unit, or is that person at the Nebraska Biocontainment Unit?
That's right. And so part of the decision was to make sure that they preserve space within the biocontainment unit here to make sure there's adequate care for anyone who might need it among the other passengers. Passengers were flown to Atlanta for further assessment and care there.
So that person is not here?
Correct.
Okay, thank you.
So again, just to be very clear on that point, we want to maintain optimal space in our biocontainment facilities on the small chance that it becomes necessary to use that space, given the individuals who are transported.
If you don't mind, I'd just love to add that we're going to expect to see people have symptoms. That's just, if you think in any given week or month, how many times do you experience some level of nasal congestion or upset stomach or something? We're being very, very liberal in how we're framing symptoms and monitoring for symptoms here. And so that's how the system is working. It doesn't necessarily mean just because someone has symptoms that they're going to end up having this illness.
Yeah.
Go ahead, since you have the mic. Hi, Diane Gallagher, CNN. Could you clarify first then, how many of the passengers who were on the plane from the cruise are here, and how many have been moved to another facility in the country?
Yeah, go ahead.
I can just address that briefly. So of the 18, 16 passengers are here and 2 are in Atlanta.
And the biocontainment unit, we have the one who had the mildly positive PCR test. Can you explain a little bit more about mildly positive? I initially thought that we were not testing people who were not symptomatic. I know they said this person was not symptomatic. Can you go into a little bit more about what it means to be mildly positive?
Sure, and I'd welcome my colleagues from the University of Nebraska to weigh in on as well. But I'll note that so this passenger, this test was not collected in the United States. The specimen was collected back, I believe, in one of the islands. It was taken on the ship. There were 2 specimens. One was positive, and the other one was negative. You know, with these PCR tests, it's not necessarily, like, even though there's a sort of exact cutoff, there's sort of a range in where they can fall. And so for that reason, we want to make sure there's further testing to evaluate that at this point more.